How do doctors make you sleep during surgery? Hi, welcome to Curious Kids Every Day. I'm Josh. How are you doing today? It's so good to hear from you. And happy Thanksgiving. Hey, have you ever had a surgery before? I have. Do you want to hear what happened? Well, I was using some tools outside one time and I hurt my finger. I'll leave it at that. I wasn't able to bend it anymore, and the doctor told me that I had broken my flexor tendon. This is the part inside of your finger that makes it bend. And the only way to fix that is with surgery. So that's the only time in all the years I've been alive that I have had a surgery. And it was very interesting. Do you know what surgery is? Well, surgery is a medical procedure where a doctor uses special tools to repair or treat something inside the body. And a lot of the time, you can't be awake during surgery because doctors need your body to stay completely still. So, what do? Do they wait until you're asleep at the end of the night? No. They actually have a way to make you fall asleep. Isn't that interesting? When I had my surgery, they put me to sleep. And it was really cool. I remember they moved me from the waiting area to the room for the surgery. And then the next thing I knew, I was awake and the surgery was over. And I was very, very sleepy still. I didn't remember anything that had happened. I didn't remember the surgery at all. They told me I had been asleep for over an hour, and I had no memory of anything that had happened. Have you ever wondered exactly what happens when someone needs to be put into a deep sleep for a surgery? How do doctors make someone fall asleep like that? And then how do they wake them back up? How does it all work? I was thinking about this question because I got an email from a curious kid named Luke. He asked, what does it mean when they put someone into a deep sleep, like for a surgery? Well, let's find out today. When doctors need to make someone fall asleep for a procedure, they use something called anesthesia. Can you say anesthesia? Anesthesia is a special kind of medicine that helps your body become very relaxed, very still, and very sleepy. The important thing to know is this: anesthesia sleep is not the same as normal sleep. It's deeper, it's calmer, and it's carefully controlled by doctors the entire time. So, how does it work? Well, there are two main kinds of anesthesia that doctors use. The first kind is called general anesthesia, and this is the kind that makes you go into a deep sleep. Doctors might give it to you through a tiny straw-like tube into your arm. That's called an IV. Or sometimes by having you breathe through a soft mask. They made me breathe through a soft mask for my surgery. The medicine travels through your blood and reaches your brain. When it gets there, it gently slows down the parts of your brain that keep you awake and aware. It doesn't shut your brain off. They just slow the aware circuits so your brain stops noticing sounds and touch and movement around you. They also pause the brain's memory-making system so you don't remember anything during that time. Okay, so that's the first kind of anesthesia they use. There's another kind called local anesthesia. Local anesthesia is when doctors only make one small part of your body numb. They don't actually put you to sleep. but the area that they're working on can't feel anything. Dentists use this when they work on your teeth. Or you might have gotten this before if you have ever had to get stitches. But for big procedures, doctors use general anesthesia. Once the medicine starts working, your brain drifts into a very deep sleep. You don't move, you don't feel anything. You don't even dream. It really is like your brain is just getting a break. Now, while you're asleep, an entire team of doctors and nurses is watching over you the whole time. There's even a special doctor called an anesthesiologist. That person's whole job is to keep you safe and asleep just the right amount. They check your heartbeat, your breathing, and your temperature. They can give you more medicine if you need it, or less if you're almost done. And speaking of, how do they wake you up? Well, when the procedure is finished, the anesthesiologist slowly stops giving the sleepy medicine. Your body starts clearing it out through your lungs and your blood, and the wake-up parts of your brain turn back on. You start to notice sounds, lights, and people around you. Most kids feel a little confused or giggly or super tired, but that's normal. Your body continues waking up over the next hour or two. You might feel hungry, but before you know it, you're back to feeling like yourself again. My wife got video of me after my surgery, and it is so funny seeing that video and seeing how sleepy I look because I don't hardly remember any of it. Anyway, in short, doctors can make you fall asleep by using special medicines that calm your brain and keep you still. And the moment they're done, they carefully help your body wake back up again. Isn't it amazing that we can do that? That makes surgery so much easier and less painful. All you've got to do is fall asleep, and when you wake up, it's all over. Okay, let's have a quick quiz. What is the special medicine that makes you sleep during surgery called? It's called anesthesia. And who is the doctor that watches you while you're asleep? That would be the anesthesiologist. And what part of the brain does anesthesia calm down to make you sleep? That would be the brain. Let's play true or false. True or false? Anesthesia sleep is the same as normal sleep. False. It is a deeper, controlled sleep. True or false? Doctors leave the room while you're asleep. False. They stay with you the entire time. True or false? You might feel sleepy when you wake up. That is true. True or false? Anesthesia works instantly and lasts forever. False. It wears off once doctors stop giving it. Would you rather fall asleep listening to rain or listening to ocean waves? Oh, both of those sound so peaceful. But I can hear the rain from my house anytime. I would much rather be listening to the ocean waves. That means I'm at the beach. All right, I've got one What Am I today for you. Are you ready? What am I? I help doctors see inside the body. You might get one if you twist or break your ankle. And I take pictures using special waves. What am I? That would be an X-ray. All right, I'm going to name a few things, and you let me know if you think these are things that help you sleep or keep you awake. Are you ready? How about a warm, cozy blanket? Oh yeah, that's going to help you sleep. What about jumping on a trampoline? That's going to keep you awake. Though I will say that sometimes we go jump out on the trampoline before bedtime to wear everybody out so we sleep better at night. What about nice, soft music? Oh yeah, that helps you sleep. What about a bright flashlight shining in your eyes? That's definitely going to keep you awake. How about a bedtime story? Oh yeah, that's definitely gonna get you ready for bed. You're gonna be nice and sleepy after hearing a nice, sweet bedtime story. Well, today we learned how doctors help people fall into a safe, deep sleep using something called anesthesia. My family has had lots of surgeries over the years, and I am so grateful for the doctors that help keep us safe and fix our bodies when they need a little extra help. And I'm really glad for anesthesia so that we can just fall asleep and wake up and it's over. What kind of question do you think we'll ask tomorrow on Curious Kids Every Day? I can't wait to find out. So until then, keep asking questions and stay curious, kids. And for all the grown-ups listening, please visit CuriousKidsEveryday.com to get a free printable with activity ideas that don't involve screens. Those are the best kinds of adventures to have. That's CuriousKidsEveryday.com. Happy Thanksgiving! I'm thankful for you. See you tomorrow!